I would like to cover it based on the in the form of case-based discussion with a couple of cases. First of all, we'll see the burden and why should we know about the cancer as such. So these are some of the statistics which show how frequent and the cancer is, and awareness amongst our medical fraternity as well as in the society is required. So people have become aware, and as I have gone through the brochure of our BMA Con this year, so two non-oncology consultants have picked up the oncology topics. So that is the awareness we can say, and that is the incidence which has increased in the society about the cancer cases. So one gynec person has taken the oncology topic, which is related to oncology, I can say, and even the GI has taken the oncology related topic. So even not only the oncologists are treating these patients, but as we are seeing more and more survivors of cancer patients, they are getting treated by multimodality specialties. Because we see in young females, the cancer patients, whenever she is survivor, then she has to undergo fertility and she has to complete her family, other issues needs to be sorted out. So these are some facts. The burden is very high. We can say almost 17 lakhs new cases cancer patients every year. 8 lakhs patients are dying from that. So what does it mean? Whenever the patient is diagnosed with cancer, almost 40 to 55% of the patients don't see their next birthday. So this is the data from the cancer registry. So these are the cancer registries from majority of the metro cities. But the actual number might be very high. The projected is almost 3 times than this data. So this is the proportion of male cancer patients. Oral cavity is the highest, lung and other. In females now the breast cancer is the most common cancer, everyone know. We'll see some cases related to hemat and solid cancer patients. So he was a 25 years old male, no comorbidity. He was admitted multiple times for thrombocytopenia. He used to get low grade fever and viral fever. Patient was admitted multiple times. Patient was basically referred for bone marrow examination to our center. So when we saw all reports, there was no hepatosplenomegaly, and when I got through the demographic details, the patient was resident of West Bengal. So we just checked the platelet count, which was 80,000, and we asked for the peripheral smear and specifically asked the pathologist to look for the giant platelets. We also looked the peripheral smear, but expert pathologist, and the smear was full of giant platelets. So this is a common, we can say, physiological variation in platelets. Whenever the patient is having giant platelets, they are not picked up by the cell counters and the count will always be low. So giant platelets doesn't require any treatment. Whenever they are seen on the microscope, then the count will be normal and they don't have functional impairment. So patient was counseled that patient does not require any treatment. It is just a physiological thing in his case, and this is very common in West Bengal and in that part of the region. Moving on to the next case, 60-year-old male, no comorbidity, patient had recurrent anemia almost for 9 months. This is a recently diagnosed case from our own hospital. OGD-scopy was normal. Patient was treated at their primary care physician with the help of hematinics and all other supportive medicines to improve the anemia. And when the patient consulted other gastroenterologist, he also asked for the colonoscopy. So 9 to 10 months patient was having anemia, recurrent symptoms. Every time patient was transfused and some other medicines were given. OGD-scopy was only done and it was ruled out that there is no problem. But colonoscopy was not advised. So whenever the patient is there of recurrent anemia, we should check for the upper and lower GI scopy as well. So patient was found to have the ascending colon mass with, when the PET scan was done, it showed liver and bone metastasis and it was a stage 4 disease. If it would have been done 9 or 10 months earlier, patient would have picked up in the early stage 1. So for this is a mixed population, so I have just put the warning signs of cancer. What are the warning signs of cancer and when we should suspect and refer the patient, or at least we should investigate so that we should not miss the diagnosis at the early stage. So this is the word caution. Whenever we see change in bowel and bladder habits, which are like duration is lasting more than 3 months, we should always suspect underlying malignancy. It can be stools, change in the color, consistency, size, shape, and blood present in the urine and the stool. So respective scopies we can advise, or at least based on the imaging we can diagnose the patients. Sore which does not heal. So most of our patients in male category, they have history of tobacco chewing and gutka chewing for oral cavity cancers. But females also we see oral cavity cancers, and most of these patients have no history of tobacco chewing or any other consumption. So in their case, there is a sharp tooth which is constantly irritating inside, and it leads to an ulcer inside, which is not getting healed over the period of time because of the negligence. And over the period of time, maybe say 9 months, 1 year, or a couple of years, it can transform into malignancy. So that is one of the reasons we see in female patients of oral cavity cancers. So if it is getting bigger, painful, or starting bleeding, then we should always suspect malignancy. Unusual bleeding and discharge from any side, blood in the urine or the stool, discharge from any parts of the body, for example nipples or anywhere, we should suspect malignancy. Lump in the breast or any other part of the body, which is a common manifestation of any malignancy, and generally patient presents to most of our consultants in this with this complaint only. But important point is whenever the tumor is in the early stage, it is always painless. And common assumption in our society is that because it was not paining, I did not consult any gynecologist or our primary care physician. So we should make the people aware that even if it is a painless lump, the chances of having the malignancy are higher. Difficulty in swallowing, so as we have discussed, feeling pressure in the throat, chest, which makes the swallowing uncomfortable, chronic dysphagia more than a couple of months, we should always suspect malignancy. Change in the moles, which is common in Western population, but in our country also we see few patients of melanoma as well. So whenever there is a change, all these features are there, ABCD, we should suspect. Nagging cough, so cough which is lasting more than a couple of months, we not only rule out the tuberculosis, but chances of getting the lung cancer are also higher. So in COVID times, we have done a lot of HRCTs, everyone has done, and during that period, many patients were found to have solitary pulmonary nodule, and some patients were diagnosed with lung cancer in very early stage. So there is a role of screening HRCT in heavily in chronic smoker patients, which is there in the guidelines, which is a low dose screening CT scan. So we should always remember the word caution, and if you, I would request to all the family physicians that whenever they get any kind of such symptoms of any of this pneumonic caution, they should see the patient cautiously and do the relevant investigations and refer to the relevant specialty as such. So immunotherapy, which is the latest available therapy in the management of cancer, if we see what are the checkpoint inhibitors, there is PD-1 and PD-L1, this is more of theoretical. These are the antibodies actually which are used in treatment of various cancers. This is the mechanism. I will not go into details because it is too much theoretical. So basically coming to indications, initially there were very few indications, one or two, but now the role of immunotherapy has evolved in most of the solid tumors and including in hematological malignancies like lymphomas. And till date, there are more than 20 indications for immunotherapy. If we see the uses of immunotherapy, now CA lung, which was found to have, which was supposed to be treated with only chemotherapy earlier, but nowadays, if the patient has got driver mutation, we treat them with the targeted therapy. This is a case of 72 years old male gentleman. He is a non-smoker. He was diagnosed to have CA lung on biopsy adenocarcinoma, stage 4 disease. No driver mutation was found and PDL1 score was 50%. Patient was not keen for chemotherapy. Even also we are reluctant to give chemotherapy at this age. And if the patient is frail, patient has got lot of comorbidities, then we try to avoid the chemotherapy. So patient as the PDL1 expressed, this is a biomarker PDL1. If it is expressed more than 10%, the immunotherapy acts better. And if it is more than 50%, it acts wonderful. So this was this patient was started on immunotherapy. After 3 months of therapy, we can see the response in the primary tumor, which has shrunk from, which is shrunk more than, we can say, 70 to 75%. So greatest example of immunotherapy is like this. Patient was diagnosed to have CA lung. Everybody knows this figure. And down the line, 4 years on immunotherapy, what is he doing? He's still playing the roles in his career. So this is the latest movie which some of us have already seen. So he is a diagnosed case of CA lung, adenocarcinoma, and he's treated with immunotherapy because PDL1 expression was very high. So one of our colleague in Mumbai is treating him, and with that I got the details. So if we see the immunotherapy, how it has evolved. So cancer vanishes from every patient's body in a drug trial. So this was one of the trial which showed that all patients of cancer had no disease and at the end of 23 months. So what is this kind of Mr. India? The tumor totally disappeared. Explain the dostarlimab for the cancer cure, hope or hype. So this was in 2024, the data had come and there was so much, it was so much in the news that even Money Control explained about it. So this was, we can say, colorally how it works. So if we say dostarlimab is a medicine which that actor used, Anil Kapoor, and he disappeared. So drug was given to the patient and the cancer disappeared in all patients. 100% response at the end of 23 months. And who becomes happy? Mogambo Kushua. So pharma company, obviously, because they will get the better results, better marketing and better sales. And we will be the spectators. We will be in the audience, all doctors. So CA breast for targeted therapy, this is the last case, 55 years old female, CA breast with bone and liver metastasis, ERPR strongly positive and HER2 negative. Patient was started on hormonal therapy. Actually, she had an impending visceral crisis. Visceral crisis means the patient is about to have the organ dysfunction. So if we see here, the patient's liver was totally studied with the disease and she was about to develop the liver dysfunction. So patient was started and after 3 months of therapy, we can see the disease has totally disappeared in the liver. Even in the neck nodes, there is a complete response. So all these patients were managed without chemotherapy and there is a scope of treatment for all majority of the patients without chemotherapy as well. But never said that chemotherapy remains the backbone for treatment of all advanced stage cancer patients. The role of chemotherapy has evolved and more patients required pre-operative management, like pre-operative chemotherapy or pre-operative, we can say, neoadjuvant chemotherapy, neoadjuvant hormonal therapy. So role of medical management in management of various solid tumors, it has increased a lot. Thank you.
Thank you, Dr. Mangesh.